Hi, everyone. Thank you for joining us today. My name is Christy Huber, and I am Reputation's Senior Manager of Integrated Content Marketing. Wanted to welcome you, and before we get going, I'd love to introduce you to our speakers. First, we have Celine Patterson of Reputation. She is our Healthcare Strategy and Consulting Manager. She's responsible for supporting our healthcare vertical's strategic and consulting initiatives here at Reputation. In her previous role, Celine built and led the online reputation management team at one of the nation's largest healthcare organizations. So she has definitely been in your shoes and understands the nuances of the industry. We also are proud to have Lakeisha Singletary, Pediatric Associates Customer Service Manager and Diversity Council Chair. She is responsible for Pediatric Associates customer experience improvement programs, frontline training curriculums, reputation management for more than 100 locations across the U.S., grievance advocacy, and serves as the Diversity Council Chair for the organization. So she's got a lot going on. But here is our agenda for today. First, we will cover the key findings from Reputation's 2022 Healthcare Consumer Survey and Reputation Report. We'll also cover how Pediatric Associates is optimizing every touch point in their customer journey. And then finally, we will wrap up with some key takeaways on what brands can do now to optimize their consumer experiences. We really encourage you to ask questions throughout the webinar. I'll be here along with Celine and Lakeisha to be addressing them as they come in. We might save for some at the end, and also you can ask live at the end as well. And with that, I am going to hand it off to you, Celine.
Thanks, Christy. So I'm sure we can all agree that it has been a very transformative couple of years. Healthcare is rapidly changing, with consumer focus becoming top of mind for more and more organizations. So, in fact, a survey of healthcare executives by Kaufman Hall found that 73% of healthcare executives believe their digital offerings lag behind non-healthcare industries. However, only 7% of healthcare organizations have dedicated resources to building a consumer-centric infrastructure in order to deliver on their brand promise of a positive consumer experience. So before we dive further into this, Lakeisha and I would love to hear from you, our audience. In a moment, you will see a poll pop up on your screen in order to answer our first question. What is the biggest challenge you are facing right now? Is it A, gaining actionable insights from data? Is it B, optimizing the digital front door? C, understanding the voice of the customer? Or D, staff burnout and attrition? So for most of you, I'm sure it's going to be all of the above. However, if you had to select just one, which would you select? So as you're filling out your responses, Lakeisha, I'm curious, what would you have said a few years ago, or maybe even today?
Thank you, Celine, for the question, and I'm super excited to be with you all today. My response is the voice of the customer, only because it deals with the perspective of an individual, and perspectives are so different. So there's not really a blueprint that we have other than really just trying to understand the feedback that they're giving us.
No, that's a really good point. I think it's really understanding holistically, all of those different feedback and the touch points.
Mm-hmm.
So let's see what our audience said. It's gaining actionable insights from data and understanding the voice of the customer were the two largest ones. So I completely agree with that. And those are two things we're actually going to talk about very much so today. So on our next slide, earlier this year, Reputation partnered with YouGov to survey over 1,200 US adults aged 27 to 64 to learn two things: how they search for their care online, but also what sources are influencing their choice of a facility and/or a physician. And the survey results were pretty interesting. They revealed some really compelling findings about that consumer journey, including how healthcare is really embracing a feedback economy in which ratings and reviews are driving business performance and growth. So our first trend is Google is co-opting the patient journey. So Google is the most popular source for searching for a physician or hospital, more popular than your provider physician websites, healthcare specific sites such as WebMD, HealthGrades, or even social media, which leads me to the second largest trend. Healthcare is embracing a feedback economy. And what I mean by that is feedback is really driving decision making, especially that third party feedback, that feedback in the wild. And lastly, feedback must be viewed holistically. And what I mean by that is that healthcare organizations can no longer rely on using just one source of data to give them insight into how they're really delivering on their brand promise. We really need to step back and view feedback from every single touch point along the consumer journey, from search to loyalty, first party surveys to online reviews, internal rounding tools to maybe your external SMS conversations. And clearly it's evident that healthcare must fully begin to adopt this consumer focused approach, the consumerization of healthcare, as we like to call it so often, which has me curious. I'd like to ask the audience one more question. Within your organization, what functional area is ultimately responsible for consumer experience? Is it digital, marketing, patient experience, or strategy CX? And I understand that some of this may overlap, but try to select one the best that you can. Lakeisha, I know we've talked a lot about this and your role at Pediatric Associates. Would you mind quickly elaborating while we give everyone a chance to answer?
Sure, but I have to say, Celine, that I'm gonna go with there's no all of the above choice here, but I'm gonna have to say all of these because it's very broad, but each element of this touches the patient or the customer at some point.
No, that's a really good point. And I think I'm interested in some of these poll responses of, I don't see any digital, but I see a decent amount of marketing and patient experience, which is what I expected in my previous role. That's where they kind of lived as well, but more so breaking down the silos between marketing and patient experience to really focus on CX. But now we're seeing more and more healthcare organizations adopting CX teams specifically.
Mhm.
So I know all of this can be really overwhelming, but what Lakeisha and I aim to provide you with today are tips on what you can do today within your respective organizations to optimize your consumer experience. The first being optimize when and where your consumers are searching for and accessing care. And as we've mentioned, that's on Google, the number one site used by healthcare consumers. So, according to Google, more than 81% of healthcare related searches are based on symptoms. So, for example, how to tell if you have a sprained ankle versus a broken ankle, or symptoms of the flu versus COVID. And once I search my symptoms, Google is going to give me results based on my keywords as well as my location. And when I click on treatments and specialists in my results, I'm taken to a list of provider locations near me that treat my condition. And that's why Google business profiles are just as important as your website, if not arguably more. In fact, 65% of organic searches on Google result in a conversion right within the Google experience. So, in other words, think about this. Google is intercepting these patients before they ever even get to your website to search for a provider or a location. So now let's walk through an example of how Pediatric Associates is kind of optimizing this journey and using feedback to drive growth. So I'm going to use a little bit of a personal example, the caregiver angle. So I'm currently 32 weeks pregnant and I'm on the hunt for a pediatrician. The first thing I did was search pediatrician near me, but then I quickly hit the delete bar and typed in best pediatrician near me. And why did I do that? It's because Google will then provide me with only the options that have 4 stars or higher. Now, one of the first things that people do once they find a provider near them is look at feedback, whether that's in search engine reviews or social media, peer review sites. I, of course, was no different. I scrolled through the options in my local area, I sorted them by rating, and I made sure that they accepted my insurance and were open during hours that fit within my schedule specifically. So I'd like to pause here and really highlight the emphasis on that third-party data. So Lakeisha and I, we come from healthcare backgrounds. I understand, the different internal feedback sources such as CMS ratings, CAPS, leapfrog gates, etc. However, not once have I used those to aid in my decision making. It's really this feedback in the wild that we call it. And this is even more true for the typical consumer that might not have that healthcare background. Doesn't mean that these first party sources aren't valuable. They very much are so. And we're going to talk about that in a moment. But it means that this third party feedback is becoming more and more important to acknowledge. So once I decided a specific pediatrician was right fit for my family, I decided to call the office and schedule an appointment, make sure they accepted my insurance. I confirmed. And at this step, others may choose to schedule an appointment right within that Google business profile or maybe access online care, such as this example with Pediatric Associates. And today they can do that through text, email, phone, direct message. The point being is the more options you have, the more frictionless the experience is to convert. And I haven't made it this far in my journey, but at the very end here, after our visit, it's almost a given that the pediatrician's office will reach out directly for feedback. And that's something we're going to talk about with Lakeisha today. And if the business is managing their feedback well, also something we're going to talk about, they will understand the patient's sentiment and turn them into an advocate. So I'm going to come up for air. All of these touch points and more are happening all the time online. And Lakeisha, we talk a lot about this digital transformation in healthcare, this concept that healthcare is looking for ways to deliver a better consumer experience whenever and wherever they are searching for care. So I'm curious, how is Pediatric Associates optimizing the first step in your consumer experience with your brand, also known as the digital front door?
Yeah, so I have to say first, maybe there needs to be a little more definition on that digital front door piece. Because before you and I started talking, I never really used the terminology. And maybe that's why when we did our poll, a lot of people kind of shied away from it. So the best definition that I can give to it is actually your digital front door is the new word of mouth, and it affects your SEO. And SEO, search engine optimization, is at the forefront. And then the next thing I'll say that needs to be realized is this is probably the most easiest way that people can leave feedback without no regard or even without a comment. They simply click on a star rating, and that's that.
Yeah, one of the other things that I think is so valuable and so important that, is really the nuts and the bolts here of optimizing that online journey is just ensuring that your listings are even up to date, right? With
Right.
accurate hours. You had mentioned, especially with mergers and acquisitions, that all of your addresses are correct, that your phone numbers are correct. Unfortunately, you have a lot of locations that are in Florida. So if you're impacted by the hurricane, making sure that you're updating if it's temporarily closed or rerouting to a different number. So how are you doing that at scale at Pediatric Associates? Because I know a lot of the audience members probably have this issue with a source of truth. Where are we really pulling from to manage these listings in an accurate and easy to follow way? So how are you doing that specifically?
So specifically, and I guess I'll give a plug here for reputation.com. We use the platform and it helps us manage all of our listings. Because being up to date with all of the things that you mentioned, they do help. And when individuals are trying to find us, so I actually like that you have one of our Jacksonville locations, up on the slides here, because this particular location, when we started in review requesting and so forth, it was long ago, and our star rating wasn't what it is today. But by simply just making sure that our listing was accurate, right? Asking for reviews, we were able to, when we moved this particular location, and we updated correctly, it was really easy for individuals to find our locations just because we had accuracy on Google.
Now, it definitely sounds like you're ahead of the curve when it comes to just the table stakes of managing these Google listings. But I always love asking this question. What next? What else do you want to be doing, or where do you see Pediatric Associates optimizing more of this consumer journey, specifically on your Google business profiles?
So I'll have to refer to or say it like this. We are always hungry for the feedback, right? Like having feedback and giving the customers the ability to just tell us how we're doing. And I know some people may shy away from it because they don't want to hear like all of the details, but we want you to tell us about it. And in doing so, knowing the good, the neutral, the bad, we're able to improve on areas that we need to improve in, celebrate those areas that we're doing great in, clarify things, right? And then also just provide service recovery. So we utilize the reviews that come in heavily.
Now, what about, and I know we talked a little bit about this previously, Q&A. It's something that we talk a lot with our clients is leveraging the Q&A within a business profile so that, maybe you're not being redundant with some of your FAQs and showing more engagement. Is that something that's top of mind for Pediatric Associates as well?
Now, explain Q&A.
So your Q&A on your Google business profile. So you know how when you go on and you can see a bunch of questions that
Mm-hmm.
people are asking, such as, are you open on Mondays? Or, for example, when the pandemic first hit, there were a lot of questions on visitation and hours and if certain service lines were even operating. And this gives either the users in Google the opportunity to answer those questions on behalf of an organization, but we really want our organizations to be answering those questions themselves and showing that engagement, just like we would want to engage with responding to reviews as well. I know that's something that is kind of top of mind for Pediatric Associates as kind of a next step.
Correct. Correct. So we are very much so. We do know about that particular feature, and I do believe that we in 23 will utilize it more so than we have. However, we're answering all the questions we can.
So as we think about, shifting this digital mindset, it's one thing to, check off all the boxes in terms of, okay, we're, managing our listings, we're thinking about the Q&A, we're doing all of this at scale. But healthcare, it's personal, right? It's intimate. We've talked about that before, especially for something as personal as choosing care for your child. What challenges do you really foresee in the future of keeping that personalization, even with something as, nuanced as this digital transformation?
So I think it's important for us, and I mean, granted, I don't want to sound like a broken record, Celine, but having one must respond. We have to respond to the reviews. I always think about how when I'm personally looking for the latest products that Amazon is selling or a new restaurant to go to, um, I go on my preferred site of searching, which is Google, right? And then I look for what it is that I want. And then the next thing I do is utilize visual communication, which in that sense is looking at the reviews, right? Looking at
Mhm.
how a person has rated a particular location. And then also, too, looking at what's being stated. And that in itself is how I decide if I'm going to move forward with ordering something on Amazon or whatever service I'm looking for at the time, a new restaurant, however, orthodontist, however, like that, that that's how I determine. And it's so interesting in this day and age that we believe what individuals we don't have any idea who these people are, right? But we believe to an extent, because I mean, some stories can be really out there, okay? So, but to a certain extent, we believe what they have said their experience has been.
No, I think that's a perfect segue into our next theme, our next trend, specifically embracing that feedback economy. What you just said so well is that it's a critical aspect of this healthcare selection process. So consider this: the top three factors for a consumer when selecting a physician are insurance accepted, location, and as you just stated, Lakeisha, the online ratings and reviews. And this is important because it tells us what most industries have already accepted to be true, that your brand isn't what you say it is, it's what your consumers and your employees say it is. So
Yes.
here are some just, really high level statistics that I really loved in my previous role because it really hit home on the importance of these reviews. Is 3 in 4 US adults read online reviews when choosing care, and they want who they choose to be rated 4 stars or higher. Again, note how I mentioned best in my earlier example of the pediatrician near me. If you aren't rated 4 stars or higher, Google will not provide you as an option in that best near me search. And 65% of US adults said they expect healthcare to provide a response to the reviews that they are leaving. So that's something I think that we're going to talk a lot about in this next slide,
Hmm.
is as these reviews are continuing to influence your visibility on Google. In fact, it's the second most important factor and the fastest growing factor at 17%. And that's even more weight than your own on page SEO for your website. And I think what's really important to note here is that Google is really prioritizing brands with more patient experience feedback because they really know how important these reviews are to consumers when they're selecting their care. But in some healthcare organizations, I think that this loss of control over your own brand can be kind of challenging and, to accept, and it's daunting. So to really embrace that feedback, it requires a whole culture change from within all the way to leadership. So, Lakeisha, this is something we've talked a lot about, right? Is getting that buy-in from our leaders. And traditionally, healthcare has kind of been a bit behind with adopting those consumer experience initiatives. So, how did you confront this challenge at Pediatric Associates to really get that stakeholder buy-in?
Okay, so first I have to highlight and shout out our Causeway location. I mean, I'm so proud of them. And I
As you
love
should be.
I, I love the graphic here. It just shows how hard we're working. So, but okay, correlation, right? Correlation has helped me and us through. It is important, and I mean it's easier done now than when I started several years ago, because several years ago reviews, they were just looked at as, I don't know if those are even real people, those might be bots leaving this information, like we're just not going to pay attention to that, right? So, but correlating is essential. And what I mean by correlating is you are literally, like, one of the things that my team and I do is we read every review that comes in, we respond to every review that comes in, and then if we need to start like an investigation, we look to see if we can find out who that person is that actually left it. And I mean, maybe you're saying, "Oh, so we need to be detectives." I don't know, maybe a little bit, right? Because we want to ensure that connection is there, right? We want our communities to know that we have the pulse of what is being said about us, and we're ready to address whatever it is that needs to be addressed. So, being able to correlate, either finding a person, or I can use an example. Um, One of the things that were coming in through our reviews when I first started, and with Pediatric Associates, was just different things about how our communication practice could be a little better. So I come from the healthcare world, right? The hospital world, And those of you out there listening, and Celine, you might know this acronym as well. It is a Studer acronym, and that is the acronym of AIDIT, okay, which stands for Acknowledge, Introduction, Duration, Explanation, and Thank. And it is an acronym that helps with communication. So one of the items that was stated is an introduction wasn't given when I came into the location, or I wasn't clear on what was stated. So with AIDIT hits on and talks about giving a proper introduction and why it's so important to tell someone your name, right? Because
Hmm.
it lets the person know who is going to be accountable for whatever else is to come next. With an explanation, we want to make sure that what we're saying is clearly understood. Like, there are people who may understand the medical terminology, and then there are those that don't. So we need to make sure we're meeting people where they are. So with that, that is a prime example that I can give you of how we were able to correlate that and put an initiative in place. And then, as a result of that initiative, which, I mean, it just took a little tweaking. Customer service is something that we just always have to review and practice, right? We don't mean not to tell anybody our name, but sometimes we just get into the process of things that we may forget. So it was important for us to just go ahead and review that simple little thing. And with that simple little change, it changed the whole dynamic of the patient experience. And we saw it. We saw it in our reviews, the volume of our reviews, and how we were being rated.
Yeah, I think that's actually, we have a great question that touches upon what you just talked about, Lakesh. Is somebody had asked, we're having a hard time emphasizing the importance of reviews within our organization, specifically why we should engage or respond and how to validate patients. Do you have any recommendations specifically for this question?
Yes. So I would say, I know there's a lot of fear, right? Or notions about responding and breaking HIPAA guidelines and all of that. But the easiest response I can give is respond and ask them to contact you. And then that be that. There are a lot of times where we aren't always able to find the individual who has left the review, but
Hmm.
our reply is in such a way that it shows that, hey, we want to get in contact with you. We want to try to produce a service recovery. So please go ahead and reach out to us here so that we could um, fix whatever the issue is as best as we can.
No, that's a really good point. I think you touched upon it just briefly there too, is it's not just responding for the sake of providing that service recovery for that specific experience, but also, engaging so that you are showing Google specifically that you're responding to these reviews, but more so for the potential patients or caregivers that you are listening to this feedback and you do care what people say and you aren't just being, radio silent. You want to be part of that dialogue. I know it was really important for me when I was searching pediatricians is that people were responding. And maybe if I saw a really negative review, either it was so negative that I knew, okay, this is, a little far fetched, or I saw a concern that to me might be a little bit, oof, that's kind of a red flag. But I
Yeah.
saw that that organization responded in a very polite, careful, compassionate manner. Then I know, okay, well, even if I had an issue, at least they're going to try to rectify it. So I think that's a really big important piece that, we respond for two reasons, that service recovery, but also to show people that we are really engaging with this feedback. We
Yeah.
have, no, go ahead, please.
I'm sorry, I didn't mean to cut you off. And please stop me if I go on a tangent. But I'm really passionate about this. It bears much weight, okay, to see that uh, an owner of a company is taking the time out to respond, right? I
Hmm.
mean, I know that's something that I look for. Just as you mentioned, that is something you look for, that even if it is a negative experience, at least they're is eyes on it from the organization, and they are willing to bite the bullet and see how best they can hear about a service that wasn't so great, but do a service recovery and turn it into something positive.
No, that's a really, really good point. And before we go to the next slide, we have one more question that I want to address because I think this is also a really great question and one that I kind of tackled with in my previous role is they said, I'm having a hard time getting my leadership bought into asking for more feedback and seeing the value. What do you recommend is the best way to combat this fear-based mindset?
The recommendation there is maybe showing them like where you are, maybe showing them other organizations that are in the same industry as you, and how they have been successful at getting feedback. Just and then again too, trying your best to correlate it back to real live experiences that may be an issue at your facility, and you see that it's noted publicly. I think that in itself should be enough. If it's not, then if this is a healthcare individual who is asking this question, then you defer to those CMS surveys, right? And correlate it there, and then just show that with the survey information. And I may be getting too far ahead of what we're going to be talking about, Celine, but just bringing all of that information together should be enough. And
No,
then expressing to them that, I mean, in the world we live in, we want instant, right? We want instant everything. We want instant gratification. We want instant deliveries from Amazon. We want instant deliveries from wherever. And with reviews, this is like the most real time information that a person can receive. And I just think it's something that we should do. We should ask. We should ask. We should not be afraid to ask. I can tell you from personal experience that these are real people giving their opinions on how things went for them.
no, I think that's such a good point to give us or lead us into our next theme is really getting that complete picture of what your patients are saying or their caregivers, what they're saying across various forms of feedback, both that first party and that third party. And that's why I mentioned earlier that our more traditional first party sources of feedback, they're still important, right?
Mhm.
Especially
Sure.
because think about this for a moment. What your customers are willing to say to you in an internal survey is going to be different than what they're willing to say about you in an external review or on social media.
Most
But the
definitely.
beauty really comes when you bring both that structured and that unstructured sources of feedback data into a single hub, really enabling you to holistically understand that voice of the customer. So it gives you the most complete picture of the macro trends that are impacting your consumer preferences while also giving you that micro view of the experiences that they're receiving at every single touch point.
Yeah.
So, no, go ahead, Lakeisha, if you want to jump in.
Yeah. Can you go back to that to the
Yeah.
previous slide? So what I would add here too, right? And for the person who asks the question is, when dealing with the perception of individuals, it is different across the map for everybody. And I say that because with your more traditional way of doing a survey, those individuals are more private, right? They feel comfortable in telling you about yourself, right? Anonymously. Okay. So then we go into the external part. And I mean, granted, it's a little bit anonymous, but I find that people are more transparent now than ever on social media, on Google reviews, on direct messaging. I mean, they are just really laying it out. And I'm in between. I'm like a hybrid. Like I'll do both of these, because I don't believe in airing out some of my dirty laundry, right? Or things that I want to keep personal, or I feel like I like to confront the individual. I don't like to I would rather tell them, okay, listen, you need to get it together pretty much. Like here's where you messed up versus going online and saying, oh my goodness, this was horrible. There was not enough salt in the food. And I mean, like I am more of a personal type individual. But this day and age we have both. We have both. And what I'm seeing now is more of that about you area where people are just really telling from start to finish about how their experience was.
Now, I think that's a really, really good point, is to really focus or emphasize, that you need to listen to all of these different feedback sources and the importance of, not necessarily negating one or the other in order to really understand what people are saying and then also identify those friction points. But here's an example of how pediatric associates, how you did just that. And on the left is survey feedback alone and the top negative themes. And Lakeisha, you and your team, you could have easily just looked at this one source, made assumptions on what trends are impacting your consumer experience. However, you couple this with other sources of feedback, as you just mentioned, your third party online feedback. And when you did this, certain themes bubbled up, so such as scheduling an appointment. Some themes stayed the same, such as quality and wait time. However, other themes, such as comfort, they fell back and new themes emerged, such as responsiveness, administration, and competence. And what I think is so important here to focus on is that you wouldn't have known about, maybe certain themes falling back or bubbling up if you wouldn't be looking at all of your feedback. So we talk a lot about this whole being greater than the sum of its parts, meaning that when we have the ability to step back and view the entire journey, we're really better able to understand where there are areas of opportunity or gaps on how we're maybe not delivering on our brand promise. So I'm curious, you talked a little bit about your take on this, but what was your initial reaction to this data?
Oh my goodness. So the initial is, I mean, in healthcare, we are just always struggling with wait time, aren't we? Like on surveys and then on feedback, wherever, it's always wait time. But anyways, my take on this is you do need both. I am a heavy promoter of getting both because it gives you a rounded overview of how things are really going. And then you are able to be introduced to new elements that you may not have thought about if you just kept to the formal way of collecting feedback from your customers.
No, 100%. I mean, I think that's also, really important to highlight that. And I don't know how this is for you, Lakeisha, but in my previous role, and we see this with clients quite frequently, is how you break down the silos within your organizations on now providing that service recovery and actioning on some of this feedback. So it's great that we know all of these themes and these trends, but how do we now operationalize it? How do we action on it? How do we leverage that feedback? So what's your take on that?
So, my gosh, that's a loaded question. Okay, let me collect my thoughts.
So
All
first,
right,
I
so
guess the question would be, how do you really, get all of these different parts of the organization that you had mentioned earlier when we did that second poll question? How do
yeah.
you get everyone to work together to provide the service recovery, but then also act on these trends?
Yeah. Okay. So that's the thing. It is a team effort all the way through the patient journey. So, and everyone's involved at some point. So when it comes to breaking down the silos, there's no secret that we can have grievances or concerns coming in from wherever a person can leave a comment or do a phone call or complete a survey or send an email. Like, it comes in from all sources. So it's important within the organization to just have those connections in the different areas where you see the complaints are coming in. So if it's having a connection in the patient contact center that are responsible for scheduling, even if we, like my team, we're able to go ahead, contact the individual and schedule the appointment. If it's something that's dealing with referrals, we know who to contact in referrals, and we do our best to make sure that, okay, we know that this is a problem and we're going to try to resolve the issue as swiftly as possible. So it's just being connected with each and every department in the organization. And that makes a difference.
No, I think that's a really good point, is getting everyone on board that, all of these feedback sources are important, and getting everyone to really align with how to operationalize that and leverage that feedback in a positive way.
Right.
So I know we've covered a lot today. To recap, these are just, the three key takeaways on how the audience can get started with optimizing their consumer experience. And you won't be able to do everything immediately. We get that. So we really recommend that crawl, walk, run approach. But the first is really start with optimizing the digital patient journey. So maximize your visibility where and when, as we mentioned, patients or their caregivers are searching for care in order to really outrank your competitors. Second, respond in real time to online feedback. Today's patients expect a kind of a consumer experience that they can get from other industries, like you mentioned, Lakeesh, retail, hospitality, etc. And it's really important that the engagement trigger for online search. And the more engaged you are with your patients, when they post feedback online, the higher visibility you will have when future consumers are searching for care. And then the third that we just talked extensively about is listen. Listen across all of your channels, your internal, your external. If you aren't looking at that feedback everywhere, you're missing important data and you're not truly understanding your entire consumer journey and where there may be friction points. Lakeesh, is there anything you want to add to these?
No, these are all very good. I agree with the crawl, walk, and advancement. It did not. We did the same thing. It was definitely okay. Let's go ahead and make sure our listings are up to date. Right. Then it was okay. Let's go ahead and make sure that we are asking individuals to leave us that feedback, and so forth. And then it just evolves. It evolves over time. So I think these are excellent points.
Lakeesh, I always greatly enjoy speaking and learning from you. And I'm sure our audience enjoyed hearing your perspective and how they can take some of this back to their organizations. Thank you so, so, so much for the great conversation today.
Yes, you are very welcome. Thank you for having me.
So we'll move on to Q&A. This is Christy again. Thank you so much, Celine and Lakeesh, and everyone who attended today. I think I can say on behalf of everyone, it was a great conversation. So please do not forget to download the takeaway materials in the Docs tab that you should see in the corner of your screen. Also, if you loved what you learned today and want to get in touch, just click the Get a Demo button at the top of the screen, and someone from our team will be sure to reach out. And definitely let us know if there are any other questions. But we thank you again for your time today, and that concludes today's webinar.